if countries can't respond individually, then we can't respond collectively. This pandemic is by far the largest pandemic that we've ever experienced in my lifetime, but it's certainly not the first crisis. When there is a public health crisis, like an influenza pandemic, an Ebola outbreak, a Zika outbreak, the world's attention is really focused on that crisis, and a lot of attention is towards the idea that we shouldn't let it happen again. But then the crisis passes, and unfortunately, people's attention wavers, and the commitment to long-term change isn't sustained. And then when the next crisis happens, we seem surprised that we haven't made progress. I think people talk about not letting a crisis go to waste with the idea that when the public's focus is on that crisis, that's the opportunity to really get a commitment to long-term change. So my first experience of large outbreaks was actually in 1996, when outbreaks of meningococcal meningitis swept through the African meningitis belt. 350,000 cases, 35,000 deaths in 4 months in some of the poorest countries in Africa. And this is before social media, so a lot of it occurred outside the public eye. But the ministers of health and the ministers of finance from those countries got together, wrote a big declaration saying, never again, we're going to commit to improve surveillance and response, lab capacity, so that we never have another crisis. But you look at it now and you think we didn't really take advantage of that momentum to make sustainable change. And I think if after this worldwide pandemic with this scale and scope, we can't commit, then it's a real tragedy.